Are you experiencing knee pain during bending, squatting, or jumping? Maybe you've been diagnosed with Patellofemoral Pain Syndrome (PFPS). PFPS is a condition affecting the kneecap and surrounding structures, causing pain and discomfort. Common symptoms include pain behind or around the kneecap, aggravated by activities like climbing stairs or prolonged sitting. Causes may involve overuse, muscle imbalances, or improper tracking of the kneecap. The patella, or kneecap, is influenced by various quadriceps muscles, including the vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. Imbalances or weaknesses in these muscles can contribute to PFPS. Now, let's delve into the top 3 rehab exercises to address PFPS. Single leg banded fire hydrant. Recent studies support this exercise as it targets the hip muscles of the injured leg, including those crucial for stabilizing the patella. To do this, attach a resistance band just above your knees. Start on your hands and knees in a tabletop position. Lift one leg out to the side, keeping the knee bent at a 90-degree angle. Focus on engaging the hip muscles. Return to the starting position and repeat on the other leg. Banded wall sit. This exercise engages the quadriceps, promoting overall stability and addressing imbalances that may affect the patella's tracking. Place a resistance band just above your knees. Stand with your back against a wall and feet shoulder-width apart. Lower your body into a seated position, ensuring your knees are directly above your ankles. Hold the position for a specific duration, engaging your quadriceps and core. Rise back up to the starting position. Weighted elevated single leg forward step down. An advanced stability exercise. It specifically prepares and loads the quad tendon, addressing potential weaknesses and contributing factors in PFPS. Stand on an elevated surface with one foot hanging off the edge. Hold a weight dumbbell or kettlebell in one hand. Slowly lower the hanging foot towards the ground while keeping the supporting knee in line with your toes. Focus on control and stability during the descent. Return to the starting position and repeat. Then switch to the other leg. These exercises, when performed with proper form and control, can be effective in addressing and preventing patellofemoral pain syndrome. Always consult with a healthcare professional or fitness expert before starting a new exercise routine.